And welcome back. Well, kidney cancer is among the 10 most common cancers in both men and women. And now there's new research about the most common type of kidney cancer called RCC. Joining us now with news from the world's most prominent cancer meeting is Dr. Robert Figlin, an oncologist with the Cedars-Sinai Comprehensive Cancer Center in Los Angeles. Good morning to you, doctor.
Good morning. Thank you for having me.
Thanks for being here. Let's chat about this a little bit. Kidney cancer, there's the most common form, and it's renal cell carcinoma, known as RCC. What exactly is RCC?
RCC is a tumor that starts in the kidney, often silently, exists for months to possibly years before coming to diagnosis. Often presents with very vague symptoms like discomfort in the flank, bleeding when you pass your water. But generally, patients are found to have kidney cancer incidentally when looking for something else.
So the age frame, now what I read is that most commonly people are diagnosed around age 64. Why is it that older people tend to be diagnosed with RCC most often?
Well, that's true for most cancers, not just kidney cancer. Cancer is a disease of aging. As our population ages, the frequency and incidence of cancer goes up, and that's true for kidney cancer as well, although kidney cancer can occur in the 20s all the way up to the 80s.
Kidney cancer must have some risk factors or causes. What are the risk factors? What do we have to be watching out for in terms of our lifestyle or things that we're putting in our body? Are there things that we can know about?
So first and foremost, most kidney cancers we don't know the cause, but the ones where we do know the risk factors, things like smoking, obesity, exposure to chemicals, familial history, are things that are occurring that reproduce and produce cancer more frequently. But I think your viewers should understand that most kidney cancers occur in families and in patients where none of those risk factors exist.
That's a little scary. What's some of the research? I know there was some new research that was recently out at the ASCO annual meeting. Can you tell us a little about that?
So the research that was presented at the American Society of Clinical Oncology meeting in Chicago has shown us several things. One, that targeted therapy now is inhibiting the path of how kidney cancer cells grow. And two, immuno-oncology agents that alter the crosstalk between the immune system and the cancer cell have now been shown to produce results that benefit patients with extension of life. So the dramatic results at the ASCO meeting in Chicago have been this phenomenon that not only can we make tumors smaller, not only can we make symptoms improve, but that we are able to extend life with now people surviving 3, 4, and 5, possibly longer as a result of these immuno-oncology and targeted therapy approaches.
Well, I think that gives a lot of hope to people, the 3, 4, and 5 years potentially. Is that only if you're diagnosed in stage 1, or what stage are most people diagnosed? I know so many cancers are not found till they're quite late.
Yeah, so that's a great question. Most kidney cancers are found at an early stage, potentially cured by surgery alone. It's when they have spread to other organs that we're talking about metastatic kidney cancer, and those are the cancers that are treated with these immuno-oncology agents and targeted therapies that have produced these remarkable benefits, in large part because those patients wouldn't have been expected to survive with past therapies.
So now that you've said a lot of this, Dr. Figlin, I know that people listening are going to say, what were those risk factors again? What do I need to look for in terms of symptoms so that I know if I need to talk to my doctor?
Yeah, so the important thing about kidney cancer is to recognize that the symptoms are often very vague. It's not like finding a lump on your arm and taking it to the doctor. Sometimes there are things that are found when the doctor's looking for something else. So my greatest recommendation for your viewers is, if you're not feeling well, seek out a physician. Let that physician help you identify exactly what the problem might be. It's going to be very rare that it's kidney cancer, but not so rare that one doesn't have to think about it.
Important information. Where can people go to find out more?
So there's websites at the American Society of Clinical Oncology, in your communities in Milwaukee at the cancer centers, and those are the best places in your local oncologists.
Appreciate it. Thanks for joining us, Dr. Figlin.
Thank you so much for having me.
Absolutely.